go.
Hello, everyone. Mike Mosquito and Maureen.
Nylene.
We're on location this week at Health Impact 26 here in New York City. We're at Times Square. We're in the Microsoft building. We're having a wonderful opening session. We had Mount Sinai on stage with us this morning. You guys kill it.
You did. I mean, what a way to open the doors for everybody else. It was such a powerful conversation that you all had. We talked about AI this morning. Pros, cons, benefits, drawbacks. There was so much to unpack there. I'm not even quite sure where we want to start. Let's start maybe first with, tell us who you are, Lisa, and your role there at Mount Sinai.
Wonderful. Well, my name is Lisa Stump. I'm the Chief Digital Information Officer at the Mount Sinai Health System and the Dean of Information Technology at our Icon School of Medicine.
Awesome. And a
Clinical pharmacist.
That's right. That's right. I love this because really across the panel today, it was doctor, nurse, pharmacist, and powerful. Okay, Robbie.
I'm Robbie Freeman. I'm our Chief Digital Transformation Officer. I work under Lisa, and I'm also an associate professor in the Icon School of Medicine in our Department of AI and Human Health.
You guys definitely brought the energy to the stage to start the day because you brought the reality of what the world really looks like at Mount Sinai. Robbie, one of the last questions was talking about what keeps you up at night. And you're like, and bad actors. And you gave them a very explicit answer on, here's what we have to do to pay attention. And here's what they're doing to try to get in the doors, right? To give the audience a little bit more of what you talked about this morning. What keeps you up? And when do you worry about bad actors? What are you doing about that?
Yeah, absolutely. One of the things that we're seeing is that generative AI is becoming a tool for the bad actors out there. So in the past, it used to be somewhat obvious when you got a phishing email, the grammar was off, and the spelling was off, and it wasn't so clear. But now bad actors can use generative AI to create really compelling outreach. They can do deep fakes. So, it may feel like I'm getting a call from my boss, Lisa, or even see it on video, but it may not be Lisa. And so that is certainly starting to make it more difficult for us to understand that you are who you say you are. And we're really thinking deeply about that piece of verifying identity. We're looking at technology partners that can help us in that space, both for our patients to make it really easy for them to get care, but do that identity verification like you may do when you go to the airport, as an example, and also for our workforce at large. I think one of the other interesting things we talked about was now this concept of agents talk to other agents. So what happens when AI starts to
I never heard of this before. So let's say that again. Agents talking to other agents. So,
that's right.
So Chat GPT is now friends with Claude.
That's right. So one of the things that's been really, in the news this last week is Moltbot, which is taken off, which is now creating social networks, and the Moltbots are talking to each other, having disagreements, having fights with each other, creating their own languages in some cases. And so our ability to really get a handle on how AI is interacting with AI, it means that we're going to need a layer of things like orchestration, things like assurance, and make sure that we're always continuously monitoring how these tools are behaving out there in the wild and have the right processes in place to intervene when we need to.
Yeah. It underscores the need. We often talk about a human in the loop. And so right now, that orchestration layer we're even talking about is that another AI agent that can perform that function. But now you've got agents interacting with each other, overseen by another agent. I personally think there's still a layer of human intervention and the same rules and guardrails that we apply to humans in the workforce, right? We talk about segregation of duties. The same person that can sign up a new vendor shouldn't be the same person that can write the check and pay the vendor, right? Because I might do something I shouldn't. And so why would we let AI agents
check other AI?
I can suddenly grant you permission to write the check. I don't have the authority to grant you that permission. And so that assurance and governance is much like the way that we create rules around hierarchies and individuals' ability to perform functions. So we need to bring all that
to that function. Let's take this hypothetical. Let's say you grant this set of permissions and guardrails here. We've got agentic AI can think about its own now. What says it doesn't get powerful enough to circumvent your guardrails, and now it's giving itself this risk because it's brighter, smarter, faster than this human guardrail you put in this place.
No, that's what keeps you up at night, right? And so that surveillance still also needs to happen. Now, ideally, we prevent it up front, right? Whether the bad actor is a human or an agent, we have to prevent people from doing bad things. There's also a layer of monitoring that says, gee, an hour ago, that agent did that thing, and we need to intervene and do something about it. Again, ideally, it's up front, but we'll also have layers of ongoing surveillance that are monitoring.
Yeah. So let's talk about surveillance a little bit too, because there was another piece that you brought up that I thought was really amazing connection in that we expect a lot out of the AI bot, more so than we do a human being. With human beings, we give forgiveness to, there's a level of empathy, but the bot, you said it so perfectly. If it goes and makes one bad decision,
shut it down.
Okay. So walk me through a little bit of what you're talking about.
Yeah, I often share the story, and this truly happened. We were deploying AI agents in our call center to help manage call volume. A senior member of my team in the organization come to me and say, if that agent makes one mistake, we need to shut the entire call center down. And I thought, really? When one of our human agents makes a mistake, we don't shut the entire call center down. We make sure our customer, our patient got the right care. We pull that agent maybe offline, we retrain them, we find out what happened, but everybody else keeps working. And so we need to give that same consideration, right? The AI agent is a member of our workforce. It needs to be trained whenever we give it a new duty or responsibility. It may need retraining as the world around us changes, or it encountered a more challenging customer for the very first time. And so we need to think about AI agents as part of our workforce, much like we think about humans and their need for training, monitoring, and performance management.
I just love that. That was such a powerful statement this morning. I think for me personally, just to have that connection of, okay, we do need guardrails, but we can't make the guardrails just walls that don't even allow us to be able to utilize technology in a way that really gets us moving.
You become an alarmist around technology. Oh, the guardrails are off. Oh my goodness. Right? Right. And then now we're not into automating or using the technology that can improve and assist. I just finished for my organization. We just finished putting in a agent assist. And it's about how to understand. We want to go to the next level of that. Now, how does it use reference of things that everyone needs to know?
Right.
It can learn very fast and reference those and bring that forward for the user, the clinician, the field, right? Much faster, because it's going to learn by these 10 people that saw something happen. It's going to learn from all 10 of those at one time.
Right.
Instead of one person trying to figure out, Bob, what did you do today?
Yeah.
Robbie, did you learn something that I need to know about my calls or my tickets that I'm taking? So I love that you said we need to give that same grace. You can't just start shutting down technology, become an alarmist around technology. We got enough of that already.
Yeah.
And I think that process of doing this over and over again, measuring how it's working and then bringing back that information helps us build trust, because trust is going to decide how fast you move in this space. Every time you roll out a new agent, we really rigorously check, how does it work? What is the performance? What's going well? What's not going well? And have those quick feedback cycles. And I think that's going to be key for us as we move forward, for getting the buy-in, getting the trust, and having the impact this technology is going to have.
So before we wrap up, Mike, I want to make sure that we talk about one other key element that really love that you said. You invite patients to be a part of this process. As a nurse, I'm always advocating that clinicians need to have a seat at the table in order to be more efficient or have that technology work to the benefit. But it's all about the patient. We forget that there are key alignments. So tell us what Mount Sinai is doing to keep that patient voice.
We have what we call our experience-led approach. And what that means is, and where we've invested on our team is building out our competencies in things like human-centered design, user experience experts. So we can go out there, engage with our patients, hear about the pain points, and allow that to guide our roadmap. So one thing we talked about on the panel is feedback we heard from patients around when they start having symptoms, when it's time to get air, patients feel like they weren't always sure where to go. And we took that feedback and we co-designed a solution that we called Check Symptoms and Get Care. And before we even went out to see, can we build it ourselves? Can we work with a platform out there? We mocked it up. We knew exactly, based on feedback from our patients, what we wanted this to look like. And every time we take that experience-led approach, I always see that those are the projects that end up being the most successful because we're co-designing them with the end user. And we've done the same with our care team. The tools that our doctors and nurses and frontline buddies use, we sit down and we co-design from day one. What should that AI look like? How does it finish your work? How do we do it in a way where we can ensure it gets adopted? And it's really easy to say, but it's quite difficult to do.
Oh, it's very
Affecting that approach over the past 10 years to ensure that we do this in a way where we get the buy-in, we build the trust, and we have the adoption.
I love it. I love it. Thank you for that being a focus of the work that you're doing. And I really just want to applaud both of you and your entire team for not just a great panel, but the great work you did over the days. Thank you.
And sharing, you just share that with an audience. So
Yeah.
you're solving problems or at least giving the navigation guide to where
Yeah.
Mount Sinai has already solved problems and how you're addressing them and what you're using to address them. So that's what we try to do when we come to these conferences, share as much as we can and take it back home.
Absolutely.
Again,
Yeah.
here on the Buzz Podcast, we love these voices that are leaders in their areas of expertise. We've got clinicians, pharmacists, doctors, technologists that come together to give you these roadmaps and guides. Here at Health Impact 26, here in New York City, Times Square, we've got Lisa and Robbie from Mount Sinai. Maureen, Nalene, and Mike Mosquito are here all week enjoying this wonderful podcast on site and on location. Find us on LinkedIn, YouTube, or on our website, thebuzzpodcast.net. And until next time, keep buzzing.